cardiology in Texas. And now Methodist Hospital is offering a groundbreaking advancement in cardiac care. And here with everything you need to know is Dr. David Pederson, Medical Director of the Electrophysiology Lab at Methodist Hospital. Welcome, welcome, Doctor.
Thank you.
No, thank you for being here. Now, folks may have heard this term if someone they know, deals with heart problems. But what is AFib?
Right. Well, atrial fibrillation is the abnormal heart rhythm. It's the most common one we see, and it gets more common as you age. So the baby boomers are going to start getting more and more atrial fibrillation. Normally, the heartbeat starts in the upper chamber and then conducts down to the ventricle, so they're in sync, the atrium and ventricle, 1 to 1. But the atrial fibrillation is just chaotic electrical activity going on in the upper chamber, and it can lead to a lot of problems, symptoms of palpitations, sometimes shortness of breath, sometimes it can be more subtle, fatigue. Long-term, untreated, it can lead to more advanced problems, congestive heart failure and strokes.
Wow, okay, and so there's a treatment that you offer that's different from traditional treatments for this, right? What is that?
It is, right. Traditional treatments have focused on the pulmonary veins because that's where the triggers are that initiate and cause the atrial fibrillation. So the pulmonary veins are in the back of the left atrium, and when they start firing off erratically, they can cause this arrhythmia. So we target those veins and want to isolate them, electrically isolate them. The new technique does that too, but the old technique either used cauterization or heat to damage that tissue, called ablation, or freezing with a cryo balloon. And it forms just a subtle little scar around those veins, and that's what blocks the abnormal impulses from coming out. The new technique uses this remarkable technique called pulse field ablation, and instead of freezing, it's non-thermal energy. It sends a pulse out that causes something called electroporation. It opens pores in cell membranes, floods it with the electrolytes like sodium and potassium, and that leads to cell death. But the unique thing is it only targets the cells we want. It doesn't affect the nerves or the blood vessels or the esophagus. So it's really a very smart way to do the ablation. And
so is that part of how it's beneficial to patients?
Right. The beneficial effect for this is that, a couple of things. I think the main thing is it's safer. I think the procedure we've been doing for years is safe, but there's still some rare complications, and it's related to that thermal damage of the surrounding tissues, either the pericardium around the heart or the blood vessels or arteries or esophagus or those tissues. And with this, we can target just what we want. So, and it's also safe. It's also faster. We can do the procedure in half the time, so patients are under anesthesia less time.
Right.
And most of them go home same day now.
And so is Methodist Hospital the only location in your group that offers this?
Well, it was the first one, and now we've expanded to 3 different centers. We have Stone Oak Hospital and Northeast Methodist Hospital and the main Methodist Hospital.
All right, Dr. David Pederson, thank you so much. You can learn more about Methodist Healthcare's heart services online at sahealth.com/heart, or give them a call at 210-974-6759.